Hello, everyone, and welcome back. Happy Monday, and thanks for joining us for another exciting AdvisorShares AlphaNooner. Today, we're joined by Jonathan Javitt, founder and CEO of NRX Pharmaceuticals, to talk very closely about one of the frontiers in medicine today, which is psychedelics. Dr. Javitt brings a unique perspective at the intersection of, biotech innovation and, of course, medicine. So excited to dig into what the company has been working through lately and share some highlights, as well as kind of touch on the current environment for biotech currently. There's a lot to cover. So a good reminder, if you're out there, if you have any questions or comments, you're always welcome to throw them in the chat. We want to connect you directly to experts. Again, Jonathan is a wealth of information, so definitely want to make sure that you have that opportunity if you need it. So with all that said, excited to have you with us. Really appreciate it, Jonathan. How is your week starting off so far?
Yeah, Mackenzie, it's wonderful to spend some time with you in the middle of otherwise global chaos.
Yes, that is true. It has been a crazy series of week and a half, 2 weeks, something like that, but it has felt like a year. So definitely interested to hear later on kind of how that impacts all things kind of psychedelic medicine related. But maybe to start, for people who are new, I feel like there are always people who are new in the space and learning more from an investing perspective or just an education perspective. Would love to start kind of with the high level view of RNX Pharmaceuticals and kind of the core mission behind what you're building.
Well, we started out developing drugs for suicidal depression and PTSD at a time when drugs targeting the NMDA receptor in the brain was a new concept. We'd be about 3 years ahead of where we expected to be if the COVID pandemic hadn't happened. But we are where we are. And this year, we're submitting new drug applications to the FDA, both for preservative-free ketamine and for what we call NRX 101, which is a fixed-dose combination of D-cycloserine and lurasidone. So people know a lot about ketamine. You're talking about a drug that is able to, at least according to the clinical results so far, reverse suicidal ideation in a matter of hours. The problem is ketamine lasts 3 to 5 days. And if you keep giving it, it's known to be neurotoxic, addictive, hallucinogenic. So we don't see it as a long-term medicine. Whereas D-cycloserine, instead of directly blocking the NMDA receptor, modulates the NMDA receptor, kind of like the difference between putting a cork in a pipe and turning a faucet. So therefore, we see D-cycloserine as something that can potentiate the long-term effect of ketamine, maintain relief from depression and suicidality with no evidence of addictive potential, with no evidence of neurotoxic potential, and minimal risk of hallucination. Now, the problem is, as we've really gotten to understand this space, medicines alone are not sufficient. We're seeing a true revolution, even an earthquake in our understanding of the brain, and especially our understanding of the brain in these diseases. And we know now that neuroplastic therapies, and neuroplastic is a fancy way of saying therapies that make nerve cells sprout and make new connections to other nerve cells, are the answer to some of the worst challenges in both psychiatry and neurology. And one of the problems with psychiatry is that for 100 years, it's been off on its own because people have focused so much on some of the really strange and scary symptoms caused in psychiatric diseases, that they focus more on the symptoms and less on the fact that all of these things are being caused by a single organ, the brain. So when we look at Parkinson's disease and see somebody with a tremor, when we look at epilepsy and see somebody with a seizure, we think of that as a neurologic disease. Whereas when we look at another brain disease that causes people to hear voices or be so depressed that they might take their own lives, we think of that as a different category of disease. So to go back to the notion of neuroplastic treatments, on one hand, we have these new medicines that are able to make new synapses, new connections within the brain, what neuroplastic means. And on the other hand, we have some non-medical treatment, non-drug treatments like transcranial magnetic stimulation, where you put very powerful electromagnets in targeted ways outside the skull. And they have a profound effect on causing neuroplasticity, new connections to form within the brain. Hyperbaric oxygen, which is now known to reactivate stem cells in the brain, cells that can cause the brain to grow in new ways. Other treatments that are coming along, digital therapeutics that are coming along, all of which have a common pathway, which is neuroplasticity, new synapses, new connections within the brain. So we began as a drug company, but as we realize how critical it is to combine these treatments under a single roof, we've started Hope Therapeutics, which is both acquiring a couple of state-of-the-art interventional psychiatry clinics that are effectively combining these treatments. And because there are so few to acquire, we expect to be building clinics that will follow that model. Our belief, and the evidence suggests, that ketamine and drugs like ketamine achieve remission or cure in between 50 to 60% of people. Treatments like TMS achieve remission or cure in between 50 and 60% of people. And the doctors who are doing these things in an integrated manner believe that they're seeing an 85 to 95% cure rate when you combine these treatments. So that's where the genesis of Hope Therapeutics came from. And that's why you're seeing us opening these clinics for patients.
Yeah, those are some fantastic results. And again, I think it is unfortunate that there is a huge, huge, huge need right now for better mental health treatments. And again, I think better tools, which I think comes from, the drugs combined with external treatments as well. So it's great to be working on that to move that ahead and forward. I do definitely want to talk about the acquisitions because I think that is super interesting. But just to kind of quickly touch back on the drug side of things. So I know you're moving for NRX 100 and NRX 101 kind of through the drug review process. Can you give us kind of a quick hit in terms of where those stand today before we kind of turn into the acquisitions, which is very exciting?
Sure. We've told our shareholders that we're going to submit. We've already submitted the manufacturing data for NRX 100. One of the things people often don't understand is that in order to get a drug approved, you actually have to have the drug in your warehouse. And not only does it have to be in your warehouse, but you've got to have 2 years of stability data, because otherwise the FDA won't even consider the application. So back in December, we told our shareholders that we had reached that stability point, that we were submitting the manufacturing data to the FDA, and we've done that. We've gotten some feedback from the FDA with really very few questions about our manufacturing processes and stability data. And we've said that we're going to be submitting the clinical efficacy data this quarter, and we're on track to do that. So that's NRX 100. It's a preservative-free form of ketamine. You may say, well, why does that matter? Why do you care if there's well, first of all, why is there a preservative in ketamine at all?
Sure.
And the reason for that is this is a drug that was formulated back in the 1970s. It was actually originally designed as a battlefield anesthetic for the Vietnam War. The military needed an anesthetic that could create very potent blockade of intense pain without any risk of stopping somebody from breathing. Because at least at that time, and even today, combat medics are not ideally positioned to intubate a patient, to put a tube down the throat and breathe for the patient. So ketamine was originally designed for that purpose. And today, probably its most common use is emergency cesarean sections, because you need an anesthetic that, first of all, doesn't require intubating the mother, but even more importantly, doesn't suppress breathing in the baby.
Yeah.
It's not a very good anesthetic in other ways, because patients wake up and say that they had horrible nightmares So a lot of and it's not really favored for anesthesia, except for some of these very narrow uses. But at the time when they formulated ketamine, they put a preservative in the bottle so that you could stick a needle into the bottle more than once and draw it up in different doses for a number of patients, because that's how anesthesiologists did their business.
Sure.
And that's actually illegal these days. There's no hospital that allows you to draw doses for different patients out of the same bottle. But because ketamine's an old drug that isn't, that's actually owned by a company in bankruptcy, nobody's ever reformulated it. And it has this preservative, benzethonium chloride, in it, where if you read the material data sheet on benzethonium chloride, it'll curl your toes. This stuff is horribly toxic. It's got a big, it's caustic, it's neurotoxic, it's cellular toxic. I first learned about this when I was involved in developing glaucoma drugs. And we recognized that people who have had 5 or 10 years of eye drops for glaucoma have chronic dry eye and corneal toxicity. And we traced it all not to the benzethonium chloride, but the benzalkonium chloride that was in all the eye drops. And that's why you see preservative-free eye drops being used. And if you walk into the pharmacy, you'll see a whole shelf of preservative-free artificial tears, because these preservatives are so cytotoxic. And you may say, well, what does that have to do with use of ketamine to treat depression? Well, it's well known that people who use ketamine on a chronic basis to treat depression or for abuse purposes frequently have a bladder condition, a cystitis, that's associated with damage to the epithelium that lines the bladder, because the cells that line the bladder are very much like the cells that cover the conjunctiva of the eye. And these preservatives just wipe them out. So we're formulating a preservative-free ketamine, which people said couldn't be done. All the literature says you got to have that benzalkonium chloride in it to keep ketamine in solution. And we've proven that's not true. So we're filing patents around that.
That is great work. Again, I think that's probably a necessity of the 70s to have those preservatives. And again, that is wild to hear that doctors were double dipping in vials for ketamine. And it totally makes sense that they've departed from that and updated their standards and practices. So again, it feels like sort of that step into the future, continually trying to.
And remember, when ketamine was formulated, it was formulated for use in the operating room or on the battlefield. So you're not talking about chronic use. And a single exposure to those preservatives is almost certainly benign, but chronic exposure is a whole different thing.
Yep, that makes sense. So being able to use it more for medicine makes sense to have that NRX 101. Very interesting. All right, very cool. Good to kind of just check in and get a pulse on where you are sort of on that drug development side of things. You did mention sort of the treatment center element. I know you had an acquisition with Dura Medical. Can you kind of give us the high level overview of, what that looked like and how that
Well, we haven't closed the acquisition. We've announced
Oh.
a definitive agreement.
Got it.
And now we're in the process of completing the audits, because as a public company, we have to release audited financials on any acquisition within 70 days of the acquisition. That's the law.
Got it.
So we're completing that process, and we're very excited about bringing Dr. Duran and Mrs. Duran into our orbit. Steve is an extraordinary clinician, began as an Army anesthetist, and has gone on from there. We've also announced a chain of clinics to the north of Dura Medical NeuroSpa.
Mm-hmm.
So that's the beginning of what's going to be a horseshoe of interventional psychiatry clinics that starts in Naples, Florida, goes up through Tampa, Orlando, and back down to Miami. So we're leaving out the Everglades. We haven't met a lot of depressed alligators that we need to treat, but we're going to treat the ring of people that surrounds the Everglades, and we're just extraordinarily excited about the people who are joining us in that process.
Yeah, that's fantastic. In terms of, number of people or how you sort of move to those next steps, do you have to start soliciting basically people who will come in and be kind of test patients? How does those next steps work?
Well, these are clinics that already have a wonderful track record of successfully treating people with severe depression and PTSD, who have, their view is that, ketamine alone whether it's intravenous ketamine or the intranasal form that J&J sells, achieves a 50 to 60% response. Transcranial magnetic stimulation, which, as I said earlier, is putting very powerful electromagnets outside the head. And I'm just going to turn on some more light as the sun sets where I am. I'm actually
Where are you?
talking to you from the north of Israel.
Oh, wow. Very cool. Big, far away distance. Thanks for making the time.
Far away distance.
Yeah.
So transcranial magnetic stimulation is the process of putting very powerful electromagnets outside the head to stimulate new nerve cells, new connections growing in the brain. And that too achieves about a 50 to 60% remission from severe depression and suicidal ideation. But what the doctors in the clinics are showing us over and over again is that when you're able to combine these treatments, you're probably looking at an 85 to 90% cure rate, which is just unprecedented in psychiatry. When I went to medical school, people talked about, maybe these antidepressant drugs will kick in and have some effect in the next 3 to 4 weeks. With years of psychotherapy, maybe we can help people get better. Now we're talking about people being better in days to weeks.
It is really shocking. I think when you learn more about it, just in terms of what the data has been able to prove out so far, I know there's still more testing, and I think a lot of people would welcome more kind of research as well, just as kind of things go along. But from what's come out so far, and the studies that have come out so far have been very, very encouraging, I think, for people who are struggling with, mental health issues, or, know somebody in their family or friends. Definitely, for sure. I'm getting a question from Brain Dead, which is, any thoughts on Alzheimer's in terms of having an impact on?
Well, so it's a wonderful, wonderful question. It sounds like your handle should be Brain Alive and not Brain Dead. And I'd love to engage with you. So clearly, Alzheimer's is a loss of cell connections. It's a loss of ideation. And there's very provocative evidence, both with transcranial magnetic stimulation and with hyperbaric therapy, that there may be embryonic stem cells in the brain that can be reactivated and cause new brain connections to grow even in our 70s and 80s and 90s. So I certainly can't tell you that any claims have been reviewed by FDA that lead to an Alzheimer's treatment. I can tell you that some of these TMS techniques have clearance for treating Alzheimer's in Europe. And one of the reasons we're setting up Hope Therapeutics is to have a clinical trials study site that's able to be on the forefront of developing treatments for other degenerative brain diseases, not only Alzheimer's, but Parkinson's, seizure disorders, essential tremor. As I said earlier, it's a little crazy to me as somebody who didn't do very well in psychiatry in medical school, but did exceptionally well in neurology and ophthalmology. And remember, the eye is just the most anterior part of the brain. It's crazy to me that diseases that affect the frontal cortex because of underlying cellular problems are treated by psychiatrists and thought of as behavioral disorders, whereas similar brain diseases that are cellularly very similar but affect the motor cortex and may cause Parkinson's or tremor or seizures are treated by neurologists. And nobody thinks that somebody with Parkinson's needs psychotherapy, but they certainly need something that's going to repair the damage to their basal ganglia.
Basal ganglia?
We're seeing the brain come together in the 21st century in really dramatic ways. And when I was a freshman in college, I walked past a guy on the bench in front of Princeton's Firestone Library every day on the way to class. He was wearing red sneakers. He had hair down to here, and he was talking to people that I couldn't see. The guy's name was John Nash. He went on to win the Nobel Prize for game theory. A lot of people saw Russell Crowe play him in A Beautiful Mind. And we think of schizophrenia as a psychiatric disease where in fact you have a brain that's essentially on fire, and it's on fire for cellular reasons.
So interesting. It's great to see. Again, I think like as more data comes out, just how it all is approached and I think processed is so interesting. And I think it hopefully will lend itself to real and better treatment over time. So I think it's very fantastic. Do you feel like psychedelic medicine is sort of helping push that change in terms of perspective and view of, diseases of the mind? I don't know what you would call it necessarily.
Well, I have a real problem with the word psychedelic.
Okay.
There's no question that ketamine can induce hallucinations.
Sure.
In the process of treating depression.
Mm-hmm.
And there's no question that drugs that block NMDA can produce hallucinations, but there's no evidence that producing hallucinations is the reason you get better. In fact, the reason you get better is, look at Connor Liston's work published in Science, showing that when you administer ketamine, you cause brain cells to sprout and to create new synapses, new connections to other brain cells. Well, there's no evidence at all that inducing hallucinations has anything to do with inducing neuroplasticity. So it may well be that the hallucinogenic properties of some of these drugs are simply a side effect of these drugs that cause profound benefit for entirely unrelated reasons. So the notion that we have to make people hallucinate in order for them to get better is a notion that is a long way from being proven.
That's interesting. Yeah, because I've definitely heard the divide and sort of debate between do you need that hallucinogenic experience to have the impact or not? And it sounds like, not. I don't know if part of that is just
Well,
coming
I
from.
wouldn't say not. I would say that there's no data to say that you do, and people should reserve judgment until we have more evidence.
That is an appropriately scientific answer. That's exactly, I think, what you want to hear. It's not definitive. It's not supported by data yet. That makes sense. All right. Well, I think that's fantastic in terms of, what you guys are working towards developing. If this works well with the horseshoe element, would the plan be to continue to expand kind of the clinics out potentially, or what's sort of the general view and scope of?
Well, we expect Hope to be a national and soon to be international network. And we expect that Hope will have a life of its own, and over time, NRX will own less and less of Hope. In fact, we may even wind up giving the shares to NRX shareholders at some point and have them be two completely separate companies. A model for Hope is a company like DaVita, companies that got into the dialysis space at a time when quality of care was highly inconsistent from one dialysis clinic to another, and patients were desperate for standards and reliability. And these days, most of the dialysis in the country is done by DaVita and one or two similar companies. Similarly, we're building or we're acquiring people who, in our view, have really been pioneers in integrating neuroplastic drugs with neuroplastic devices, with digital therapeutics, soon with hyperbaric therapy, so that we'll have a replicable treatment protocol and one that can be implemented on an international basis.
Very interesting. So yeah, so making it more accessible, but more consistent in terms of if you go to a place in Wyoming, it's going to be the exact same experience as if you went in Florida and being able to get those treatments.
Yes.
All right. Very interesting. That's very exciting. Again, I think as psychedelic medicine is continuing to pick up kind of momentum and focus and attention, I think that's, a great time to be growing out like that. So
yeah. And please let's think of it as neuroplastic medicine.
You're right. Sorry. It's a bad habit, I guess.
I know. Well, everybody wants to call it psychedelic, although, TMS, the very fact that transcranial magnetic stimulation can achieve a 50 to 60% remission rate and certainly doesn't cause hallucinations ought to tell you that hallucination is not what this is about.
That's fair. All right. It's more of a mouthful, but I'm very happy to say neuroplastic related.
Yep, neuroplastic.
That sounds good. All right. Well, then let's talk a little bit just kind of about the, landscape that we've been seeing lately. I think there's been a lot of support for dang it, got myself, for neuroplastic related medicine and psychedelic medicine.
Well,
But
I agree that the Secretary of Health and Human Services keeps using the word psychedelic, and so does the head of the Department of Government Efficiency. But that's just because they and I haven't had enough time to sit down and talk about this.
you got to get a meeting. Would you get a meeting, I guess, to be able to make a case, even though it sounds like they're already strong proponents, both RFK Jr. and Elon Musk? Is
Yeah,
that
I think it's likely that we'll have an opportunity to meet.
okay? Very interesting. All right, that would be great to be able to kind of tell the story, and I'm sure again, it seems like they already have a sense of how important it is, but being able to understand that, and if I see them saying neuroplastic medicine, I know you've had that meeting, so that'll be good. But okay, so maybe speaking to that a little bit, again, they've been pretty staunch supporters, I think, lately. I've seen a lot of, tweets or Twitter X posts. What's your sort of take on this year, especially with them now more in power, how that translates into kind of setting up an environment for a company like NRX?
Well, there are a couple of things that Secretary Kennedy said that are pretty important to us. One is he clearly recognizes the importance of this class of medicines for treating suicidal depression and PTSD. I mean, an American dies of suicide every 11 minutes. When I went to medical school, breast cancer was considered a lethal disease. Today, the survival rate from breast cancer is 91%. My son is named for my mother's brother who died of leukemia at the age of 6, at a time when ALL was considered a lethal disease in children. And today, almost no child dies of ALL. It's considered a curable disease, and one where the cure continues to expand. And yet, in all of that time, we haven't bent the survival curve from suicidal depression at all. The only FDA-approved treatment for suicidal depression today is electroshock therapy. And about the only difference between electroshock today and the scene in One Flew Over the Cuckoo's Nest is today we anesthetize you and paralyze you before we induce a seizure in the brain. We can do a lot better.
Yeah.
And the Secretary of Health and Human Services knows this. The newly confirmed commissioner of the FDA knows this. And it's really time to positively bend the survival curve in suicidal depression.
Yeah,
Losing 50, 100,000 Americans a year is just crazy. I fly once or twice a month for the U.S. Coast Guard Auxiliary. And the entire U.S. Coast Guard was stood down for 90 minutes of training in stress resilience and suicide prevention last December, because it was publicly released that we lost 14 shipmates to suicide in a year where we didn't lose anybody to operations, even though the Coast Guard dangles people over Arctic waters from helicopter. It's unacceptable. And we now have public health leadership in place that has identified it as being unacceptable. Now, the Secretary has also made it very clear that the continued use of toxic preservatives in foods and drugs is unacceptable to him. So we think, both from a perspective of introducing a drug like intravenous ketamine for suicidal depression and PTSD, but also taking the toxic preservatives out of it, we think that we're aligned with the public health direction of the country.
Yep, that seems perfectly aligned. That's fantastic. Anything else in terms of the current administration that kind of has your eye? I know it's been a kind of, not year, I guess, a few months of pretty extreme change, whether that's, I think, positive change around embracing things like this type of medicine and, really having an eye towards the health of the public. But I know it's also been a little bit disruptive just in general as things are kind of shaking out, definitely on the trade war side of things. Would just love to know, does that have any impact in terms of even?
Well, there are a couple of places. There are a couple of places to focus. One is that both the Secretary and the newly confirmed FDA Commissioner made it very clear that there has to be more of a voice for small and even micro cap pharma in the drug approval process. that an environment where only big pharma can succeed is no longer acceptable to the FDA leadership. And you've seen some very prominent departures. In fact, some of those prominent departures have taken very well compensated jobs in very big pharmaceutical companies. So I'm optimistic that small companies will get much more of a fair shake going forward. But the trade war that you're seeing emerging really is problematic in that an unacceptable amount of the active pharmaceutical ingredient, what people call API, that's used in American drugs, in addition to finished drugs, comes from China. And we started out making not NRX 100, but NRX 101 in China. Long before we were a public company, we had an episode where somebody tried to slip a counterfeit ingredient into one of our manufacturing batches with phony paperwork. And we weren't. This was years before we were a public company, so the only disclosure we made was to law enforcement, and we caught it long before that manufacturing batch got anywhere near human beings. But there have been huge problems with that supply chain for many years. None of our API is coming from China, and in fact, we have enough API in our warehouses so that we can make 3 or 4 years of drug without having to worry at all about our supply chain. And all of our manufacturing has been moved into the United States, into companies that really know what they're doing.
That's really interesting. So yeah, you had you made that change just based on that, bad attempt, I guess, to supply incorrect or counterfeit?
Well, we moved onshore both because of that experience and because of the COVID pandemic. All of a sudden, we recognized that long supply chain was just absolutely untenable.
Yep, very risky. All right. Well, then again, better timing around being ahead of the tariff war and sort of the disruptions around the supply chain. Being able to produce it here has got to be a big advantage, I would imagine. So that's great. All right. I'm seeing one more question again from Brain Dead as well. The question is, if it does go into the hands of a therapist, doctor, how can it be distributed? So I guess once
that's a great question, because you're talking about drugs that and your notion that it'll go into the hands of a therapist is not necessarily entirely aligned with what we're doing, because the people who deliver these drugs tend to be anesthetists, CRNAs. They tend to be physicians who are either anesthesiologists or psychiatrists. They tend to be nurse practitioners. And those are people who are delivering treatment rather than therapy. Whereas the Hope clinics certainly have therapists associated with them. But the process of psychotherapy is very different from the process of neuroplastic treatment. But what you're really getting at is the notion that simply putting a drug on the market, putting it in the pharmacy and hoping that it gets used right, especially with these drugs that can be addictive, can be neurotoxic, really need intense monitoring. These are not pharmacy drugs. These are drugs that, at least to our way of thinking, are going to be used in specialized clinics. And that's why we're building those clinics. We don't anticipate that we'll be the only people in the business, but we do anticipate that will have a profound effect on the way in which these drugs are used, whether by us or by our competitors. And we welcome competition, because you're talking about a disease that affects close to 50 million Americans. Living in Miami, I'm no stranger to offshore fishing, and I've never been down at the harbor and seen 2 fishing captains arguing about who caught whose fish out there in the Gulf Stream. There's far more fish than there are boats.
That is a very interesting perspective. And again, I think it does tie into you're working on kind of a noble aim to help with a very difficult issue for a lot of Americans and a lot of people in the world as well. So I think it's fantastic to be doing that work. And again, obviously you want to be well positioned. It sounds like you are well positioned. But I think it helps when you're working towards something that does a net good in the world. So that is great to hear. All right. Well, you've given us a ton to digest and kind of work through, a lot of great insight. Any sort of final thoughts before we maybe point people to where they can kind of stay in tune with what's going on at NRX?
Well, Mackenzie, it's always a pleasure to talk to you. I'd love to come back and sort of do a science section with you and maybe throw together some photos and videos and really help people understand what this frontier of neuroplastic treatments is all about. Because as some of your audience pointed out, we're not just talking about depression, PTSD. We're talking about Alzheimer's. We're talking about Parkinson's. We're talking about some of the most debilitating diseases that affect Americans, and the world is changing in profound ways.
That is all very, very exciting. Well, again, thanks for making the time. Really appreciate it, especially when you are away. Definitely appreciate that extra. Thanks everyone for joining us. Really appreciate it. Hope this was insightful for you and gives you some great education into the world of this type of medicine. Hope you will stay tuned with them. Again, I would recommend checking them out on Twitter, of course, is a quick way to stay in touch, but of course on the NRX pharmaceutical website, a lot of great information there as well that I would definitely point people to.
And next time we do it, let's track down Braindead and get him on camera or her on camera with us.
There you go. You're welcome. That would be great. Awesome. Have had some great questions. So do appreciate those as well. All right. Thanks so much again. Really appreciate it. And we will catch you next time. Thanks again.
Thank you.
Before investing, carefully consider the investment objectives, risks, charges, and expenses found in the prospectus, available at AdvisorShares.com.